MPox has been around for quite a while, but there is a resurgence, which is causing a little bit discomfort. And that is where I want us to start.
Sure.
From what you see and what you're hearing as the CDC, are we correct to say the discomfort, should actually be treated with urgency, or should we, continue to manage as we've been managing before?
You're right that it's been around for a while, and we use the word endemic to describe that. But it has been endemic in the west and in the central part of Africa. The fact that it is now making its way to East Africa over the last couple of years is a reasonable source of concern. In other parts of Africa, we've seen a clade or type called clade 2, but in the east we're seeing clade 1, which so far has been associated with high rates of severe infection as well as mortality. So yes, I think I would agree with you that it should be a source of concern for us. I think it's important to note that because of Uganda's experiences with multiple outbreaks over the years, and because of the partnership that we've developed as the U.S. government through CDC to build Uganda's own capacity to respond, Uganda is in charge of its own MPox response as we speak. I think that should offer a lot of confidence to Ugandans that the Ugandan government is leading its MPox response. Now, CDC, our role has been supportive. Starting at the central level, we are sitting with the National Task Force, we're sitting with the Incident Management Team to work together on strategy for addressing these, to work together to develop guidelines. We're also helping on the front lines in the field through our implementing partners to identify cases, particularly on the borders that are high risk, borders of DRC, for example. We have worked with the Ugandan government to build capacity in a host of local epidemiologists who are doing these types of case investigations and tracking contacts in the community.
MPox has been endemic in DRC, and these cases have not just turned up to 14,000 in just 2 months. What do you see as the challenge? I mean, why do we have hosts of these infections in numbers, even with the available support and knowledge and information about these infections?
The fact of the matter is we're now in a global world. There's a lot of movement and travel. There's urbanization as potentially a cause. There is also the issue of climate change. Actually, I think what it has then also forced us to do is change our approach a little bit. I would say previously emphasis on certainly prevention and when it happens, response, but more and more we're spending a lot of time and resources thinking about predicting these infectious disease outbreaks. And some of that work is happening right here in Uganda. The CDC supports the surveillance of different infectious disease outbreaks, including even some work that we're doing looking at bats in different communities where we've seen resurgence of infectious disease outbreaks, to see if we do surveillance in bats, perhaps we can predict it. Predict viral hemorrhagic fever outbreaks, and therefore, curb or mitigate the possible effects of infectious disease outbreaks. The other, I think, really interesting work that the Ugandan government is doing is looking at wastewater surveillance systems to see if that can be a predictor for different infectious disease outbreaks, including COVID-19, etc.
Dr. Mary Boyd is the country representative for the CDC here in Uganda. That's all we had for you this evening. My name is Walter Mwesigye. Have a very good evening.